This week, a lot of people are getting second doses. In the coming weeks, you're going to see more first doses are going to be available. So I think you'll see appointment availability is going to improve in our Friday night rollout, and then next week as well. But one of the things is, and part of why we went out with the new 16 to 64 group is there's other folks who have vaccine, like CVS and Walgreens have vaccine. And so we have that. And, when we look at what was going on last week, appointments weren't being filled. And since appointments weren't being filled, it made sense to open to the next group. And that's what happened there. Obviously, we didn't anticipate as much demand that was going to be there. And I think it just speaks to a larger issue. I'm sorry there was so much frustration about people going through the website. I'm really sorry that happened. I think one of the things that we just have to be cognizant about is that, it's going to improve over the coming weeks. It's not just the supply of vaccine, but the appointment availability. And as that improves, more and more people are going to get the vaccine. I will say this. One of the things I hear from people is once they get to the sites, I heard from somebody today, it was amazing how well it was done at the Dunkin' Donuts Center. It just went through the whole system. I think it's what people find is when they get their vaccine, it's a pretty streamless process, no matter whether at one of our state sites, municipal sites, or the pharmacies, it's running pretty well. So we just need to improve the system. And it did make some upgrades last night. So this morning went pretty well, and it's going to get only better at this point.
Now, this morning were the only available appointments in Middletown though?
Yeah, there was only a limited number of appointments available this morning because we're still doing a bunch of second doses, but that's going to change come Friday night and next week as well.
Okay, so but it was only in Middletown.
As far as I know, that's all we had available.
Okay. Yeah, it was just Middletown. That's the newest site, so that's where we have the most capacity. The others are booked out for second doses.
Okay. Now, my other question is, I know when we go through we look at how many doses we're getting each week, they say first doses and second doses. So are we not getting as many first doses as we were supposed to?
No, we're getting about 50,000 doses a week. But keep in mind, we weren't saving second doses for people, and so when doses come, people sign up. Some of those doses are already reserved. So when those 50,000 doses go in, they go right into people's arms right away. So there is no warehouse full of vaccine waiting for people to get their second doses. We just keep going. Because keep in mind, we really want to get as many people vaccinated as quickly as possible. And that's the whole approach. You got to go faster and simpler. And it's just about getting as many people vaccinated as quickly as possible. That's really the overarching strategy right now. And right now it seems to be working. We're getting people vaccinated, but we do have to improve our system a little bit.
Okay. So when they said, this morning, they were going through the numbers and they were saying we get 15,000 first doses of Pfizer a week and then 14,000 second doses. So, but you're saying that number is really a total number?
Yeah, so we're getting about 50,000 doses a week.
50,000 between the three different vaccines? Between
the three different ones.
Okay.
And there was only the first allotment of J&J. We haven't gotten any more J&J since the original 9,100 doses.
Okay. Well, they said another 1,300.
Yeah, well, then you might have known that. But I know there's more coming by the end of the month.
I just wanted to make sure I was understanding those numbers correctly. Okay.
We're expecting another 16,000 doses by the end of the month of J&J.
Okay.
Which will be good because that's, that's one and done.
Yeah. Now, sorry, I'm just looking. So that is the site. And then, so this week it'll still be kind of tough, but then next week, much more will become available.
I think it'll open up next week and in coming weeks. I think just, word of advice to folks right now, if you're frustrated last Friday night, I'm sorry, I'd be frustrated too. And, this morning sold out pretty quickly, but I think what we're going to find is just be a little bit patient, if you would, a little bit more patient. I know you've been very patient for all the past year here, but it's really give it a chance. Try again next Friday night at 5 o'clock and then try again next Tuesday morning at 9 o'clock. But keep in mind, CVS and Walgreens have their own supply. And so they open up their own appointments too. And some of the municipalities have some availability as well. So there's multiple venues for people to try here. And I encourage people to be patient though. A good rule of thumb though, is that just if you're getting frustrated, just take a break and then let's try another day. And quite frankly, because it's not worth getting frustrated over, because within 6 weeks or so, we're going to have enough vaccine, I think, for everybody. I really do, within about 6 weeks, think that everybody's going to have a chance to do this. So we're all going to get to the same place we want to get to. It's just a matter of being a little bit patient at this point and letting us all get there.
Okay. And for the system, I know, and I'm not sure if you are like privy to this. But I know Joe had said that there's going to be like a waiting room almost.
Yeah, a little digital waiting room. So people, when they get in their reservation, they don't get sort of having it snatched out before them. So
but isn't that what Massachusetts did and it didn't really work?
Well, our vendor's working on improving it, and making this digital waiting room here. I'm optimistic it'll be better than what we have. Because what was frustrating for people Friday night was they were signing up, taking the time to enter the information, and then by the time they get the information, the vaccine was taken. And that's hard for everybody. And that's not what people are used to.
Okay. All right. And then kind of just getting into, like you just said, you're hopeful 6 weeks. How, but then we're looking at the numbers in this other meeting and they're saying we're not going to get to May. I think right now it still says 39 to 16 doesn't start until June, according to the timeline. How do you explain that to people?
Yeah, well, it's about supply. So quite frankly, if we get the supply, we're ready to give it. Like we can give the vaccine if we have the supply. In other words, the rate limiting step isn't us administering vaccine right now. It's actually getting the vaccine. So if the federal government can get us the vaccine, we're going to be ready to give it. Now, I think what you're going to see is the numbers are going to improve. In other words, I think we're going to get more Pfizer and more Moderna vaccine and more Johnson & Johnson vaccine. The Novavax vaccine, which is another one that is out there, which is, we're seeing some nice data on that one. I don't think that's going to come into play until May, because that's when its meeting is with the Food and Drug Administration. So I'm assuming the federal government has got more vaccine out there for us to give. I mean, the president made a declaration, and we're ready to deliver on the president's declaration. Rhode Island is ready. If any state can do it, we can do it. It's just a matter of, you have to give us. It's kind of a show me the money. If you show me the money, we will deliver the product. I'm very confident in our team. We will deliver the product.
So when they do these projections, are they just being extra cautious?
We're just reporting on the numbers we have in front of us, and we only get a 3-week sneak peek of what we're going to get. So I'm assuming those numbers are going to change much higher, because we know how many people are in our state. So we're expecting that those numbers are going to increase. So I'm assuming the supply from the federal government is going to improve.
Okay. I know it's not what you want people to do, but everyone looks to neighboring states, right? And Connecticut yesterday said April 1st, they think that they'll be able to open it up to everyone. Do you think they're estimating differently, or what do you think is different there?
Yeah, so everybody's in the same vaccine allotments per capita. So I'm not sure how one state can say, we're sure we can do this, when other states are like, well, we just haven't seen the numbers yet. Maybe it's us just being a little bit cautious. We're just looking at the numbers. But I'll tell you this, if we get the vaccine, we'll deliver it to our people really efficiently. We've proven we can do that. It wasn't too long ago, people are saying, well, why are you ranked so low? And now we're in one of the top 10 states, but that's because we know how to deliver the vaccine. It's just a matter of getting the product here. And I think one of the things you're seeing too in Rhode Island is, one of the variabilities between states is how much vaccine hesitancy there is. You're not seeing a lot of vaccine hesitancy in Rhode Island. Rhode Island's always been one of those states that leads in vaccine. So I think we're going to see a nice uptake once we get it out there. And that's where I think people just need to put big perspective around this. I really do think within 6 weeks or so, we're going to get to a point where anybody who wants a vaccine can get it. I think that's very realistic. I think it's a matter of just having that long view here is well before, before Mother's Day. If you want to have a vaccine, I think it's realistic you'll have one.
Okay, but your team, the work group team is looking very much at numbers and not really at guesses.
Well, I think they're just working with what they have in front of them, but I think we have to just trust right now, when the president makes a declaration, I'm assuming if he's going to write a check, he's got something in his account to cash it. Because quite frankly, that was a pretty powerful declaration he made, that everybody's going to have enough vaccine by May 1st. I'll just tell you, Amanda, Rhode Island's ready, willing, and able to administer as much vaccine as we can get. Quite frankly, we'd love to have more. And I think you can actually make an argument that Rhode Island actually deserves more than other states. We're a very densely populated state. We have a lot of high density communities. We're the second most densely populated state per capita. And we're seeing more of the variant here in Rhode Island. Like one of the things I was just looking at this morning is, I just looked at some data of 85 specimens sent for genomic sequencing. 12 are positive for the United Kingdom variant. That's about 14%. And that data is from a week ago, or at least. So that makes me think that we've really got to look at the variant for what it is. It's here in Rhode Island. It's not the dominant strain yet, but we really have to be prepared to manage this variant. And this is one thing where if I can say to Rhode Islanders, look, while you're waiting for the vaccine, I got to give you something to do. I got to give you an assignment here. I wear a high quality mask. I have this is it's not a medical grade N95, but this is an N95 I bought, off Amazon. Nice, 3-dimensional, sturdy mask, fits my nose well. One of the things I like about this one, it fits my nose so well, my glasses don't fog up, which I don't know if anybody else is sort of tired of that, but I like not having my glasses fog up. So that's another tip, just so you know, if you don't want your glasses to fog up, is breathe through your nose when you're wearing a mask, and then you're less likely to have your glasses fog up as well. But I think this is a reminder, we all need to be wearing high quality masks. It's the one big thing we can do is either wear an N95, a KN95, or a KF94 mask. So while you're waiting for your vaccine, make sure you upgrade to a high quality mask. You have that assignment from me. That's one thing you can do to make sure you're not acquiring disease. This mask protects you from spreading to others, but also protects you from acquiring disease from others. So it's very important to have a high quality mask.
Okay. And I think really kind of in wrapping up, is there anything specific, obviously you're saying we need more supply from the federal government. Is there anything, specific being done to kind of continue to put that pressure on them?
Yeah, the governor's lobbying, and we're lobbying with the congressional delegation to advocate for Rhode Island. Keep in mind, we all live close together in Rhode Island. We're a very densely populated state. So I think we have an argument to make that we're much higher risk than other states are. And I think to that extent, there's a lot of advocacy going on our behalf. We're not trying to be anything more than just fair with the other states. I'm sorry when there's position of competing with other states, but that's the way the whole pandemic has been. I mean, quite frankly, this is what it is. But the governor's office is advocating as hard as they can to help us get more vaccine.
Okay. And then, sorry, I just thought of one more thing. They also said that they were going to be in the high density populations in Rhode Island, there's going to be like allocated days at the vaccine sites. So does that mean there's going to be less like vaccine in Providence for other people?
Yeah, what we're trying to do is move, we really have to be honest about the high density communities, Central Falls, Pawtucket, some parts of Providence. We just haven't had as much vaccine go in there as we need to, but we're seeing higher hospitalizations in those neighborhoods. So it's just a matter of working with the municipalities to make sure people are actually from the communities we're most concerned about actually getting the vaccine. The municipalities have a way of validating those folks and getting those folks signed up. And that'll happen rather seamlessly when people sign up. But I don't want people who live in those vulnerable high density communities to ever feel like they're forgotten, because they're not forgotten. It's just a matter of kind of catching them up and giving them the protection they need.
Okay. Do you know when that'll start?
It looks like it's going on next week here.
Okay.
It's going to start here in Central Falls, Pawtucket, and parts of Providence.
So they'll be able to go to like the dunk.
Yeah, they'll be able to go to the dunk and then some of the municipal sites as well in Central Falls and Pawtucket.
Okay. All righty. Is there anything else that you want to add? I think I cleared, I just want, it's very confusing for everybody else when they see and hear so many different things. So I just wanted to kind of have you say it a couple different times.
Yeah, no, I appreciate it. The last thing I have to say is, I think this is a moment in time where we need to really say we need to be really cognizant of the risk of the variant of COVID. In other words, I just said, of the specimens we tested last week, 12 out of 85 were positive for the United Kingdom variant. That's 14%. That concerns me. It's a small sample, but that's probably indicative of what's going on in the rest of the state. And I'm just saying is that I know people say they're tired of the pandemic, but I can assure you the pandemic is not tired of you. And the virus really could care less what the weather looks like or what day of the week it is or what month of the year it is. And quite frankly, this is where people need to really look at, you should know how to manage yourself during the pandemic right now. And if I get people, just remember, I need you wearing a high quality mask. I need to limit your contact as much as possible right now, just to one other household. But this isn't a time to say, woo woo, the pandemic's over, because it's far from over right now. And quite frankly, in 6 weeks, we can be in a much better place if people do still stick with the game plan right now. If people stick with the game plan in 6 weeks, we could be in a really cool place. Because what I would love to see is Memorial Day happens in Rhode Island, looks like every other Memorial Day in Rhode Island. That's awesome. I want to see our beaches packed. A lot of people having a lot of fun. I just want to have a great summer. And that only works if we can keep our case counts down over the next 6 weeks. That's something we all have to do. We got to be committed to that.